Hey, kids cook real food. Katie Kimball here for the Healthy Parenting Connector, where, as always, we connect you, parents who really care about your kids, with the experts who have the information you need to raise healthy, independent kids in mind, body, and spirit. Today, I'm honored to be joined by Dr. Neda Gioia, who is going to talk to us about a topic we have never addressed on the Healthy Parenting Connector before, and it seems really specific, but we're going to show you why it's not. Thanks again for being here today, Doc. Appreciate it.
Thanks so much, Katie, for having me today. I'm so excited when people like yourselves invite me to these types of platforms. I think it's so important to spread the wealth of education, especially the earlier the better. Proactive, that's the way that we want our
Yeah. And
parents.
this is going to be so interesting. I just really think we're talking about ocular health or eye health. And for me as a parent, not something I've spent very much time thinking about. So I know I'm going to learn a lot today. And I'm guessing most other parents out there are in my boat. So if you're feeling a little skepticism, just hang on, enjoy the ride with Dr. Joya and me, and we'll just teach you something that you hadn't even thought about before. So officially, I want people to kind of know where you're coming from and why you're here. Dr. Neda Gioia is a licensed optometrist with over 15 years of clinical experience in 3 different states, and she added a functional medicine certification to her biology and psych degrees from Rutgers and her optometry doctorate from SUNY. Do you kind of have an addiction to learning, Dr. Gioia?
So yes, and I am currently in another program. So absolutely, I just can't stop. I love it. I think it's the way that I like to clinically help my patients. The more I learn, the more they learn. That's how I feel.
Yeah. So honestly, listeners, hot tip of the day, if you're working with a doctor who hasn't done any learning in many, many years, you probably should switch gears because research is always changing and we all want doctors who are addicted to learning and who just can't stop. That is the best. Dr. Joy is the founder of Integrative Vision, an optometry practice with a special emphasis on nutritional interventions and preventative modalities for eye health. It's absolutely groundbreaking. It's groundbreaking. I have never heard, I don't think, of an optometrist with a functional medicine degree. So I am just so excited to sort of dive deep and
Mhm.
blow this topic up for people. I love that Dr. Joya believes one should maximize ways to improve quality of vision and reduce ocular disease risks and to heal, educate, and ultimately empower patients to achieve better health and a better life. So where did this start for you, Dr. Joya? How did you get, interested in the
Um,
eye health and then the functional world?
yeah, so I'll keep the story very short because it's a very long story. Eye care was an easy choice for me. I went from dentistry to eyes. I didn't find dentistry very appealing and I did not love surgery. So I did a lot of work in high school to narrow down what medical field. I always loved medicine, so it was easy to go into the eyes. I found it very intriguing and the fact that I still can do whole body care. And then I worked as, in clinical care for, I would say almost 10 years, a little bit less than 10 years before I transitioned into functional medicine. And that was a personal reason. I didn't even know that that existed. I was in the right place, the right time in Seattle, where there's a huge naturopathic influence.
Mm.
And I got sick myself. I won't go into details, but I got very sick, and conventional medicine could not help me. And I said, what do I have to lose? I'll start looking to alternative paths. And let's just say it was the best decision of my life.
Mm.
And I am here today almost as a mission. I said, if I can feel better from functional medicine and learn how to help others, that is my life goal. So it's not really a passion, it's more of a mission for me. And that's why I decided to go back to school and start certifications and various degrees. I actually am a certified nutrition specialist as well. And right now it's just go, 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 trying to teach other physicians and other nutritionists to not only see eye care as a way to introduce nutrition, but vice versa.
Mm.
And we are growing in numbers. We have a society. I sit on the board for ocular nutrition. and we are promoting, and we're just growing and growing every year. So I am happy to say I am rare, maybe to someone who doesn't research this much on the eye side, but we will become more findable, where there are more certified optometrists that have functional medicine or nutrition also as a dual certification.
That is so great. And of course, yes, when you're doing something groundbreaking, you have to like help it spread and you have to hit the trail and work so hard. And so I'm sure all of us are glad that you are on that path and following that mission. And
Mhm.
I think today we're going to talk a lot about the bi-directionality, right? Of eye health to whole body health to nutrition. Like once you start uncovering some of these layers, you realize as you are that you just have to keep learning and keep going and keep digging. Now, you were a pretty traditional optometrist for almost a decade, you said. What
Mhm.
makes what you do now different from, I can walk 2 blocks and get to my closest optometrist? How are
Mhm.
you different than the care I would get there?
So, my office in particular, because of how I've been trained, we offer services that are beyond routine eye exams, which are nutritional based.
Mm.
So I will actually review things that the patient needs to eat or take supplementally to, address certain issues that they're having. Now, not to say that local optometrists that are not double trained don't also provide really good care. And I think the purpose of this podcast is not just for me to introduce ocular nutrition, but also to introduce we need to check our children's eyes in general. And that's a lack for most of our nation. A lot of parents don't know the proper schedule to check their kids. So what I provide though is a higher element of nutritional emphasis, where I dig really deep. I spend a lot of time with my patients, one-on-one, and it's something that I'd like other practitioners to start implementing into their practices. But I do see value in a general optometrist that is there to really help screen for eye disease or early detection of eye conditions in children. It's very important.
Well, let's talk about that because I know, I think especially at the kindergarten age, our kids get their really basic vision and hearing screening. Every time we take our kids to well child checkups, they turn off the lights and my kids look into some sort of machine and they tell me
Yeah.
their eyes are great. What am I missing? What do we need beyond those 2 basic screenings?
So that's the key word, screen.
Okay.
It's not an exam, right? Those are two different words. So they did not get an eye exam. They got a screening. So, screenings are looking for just a few points, right? Certain points, and other things are not checked. So you pass the screening, you did not have an eye exam. So you can still have issues even if you pass. According to the American Optometric Association, most people don't know that children are supposed to have their first eye exam under the age of 1. And then again, without any symptomology between 3 and 5. And then again, before they start school,
Wow.
officially, or start, their grade school. So that message is missed oftentimes, and we depend on screenings that can be done by untrained people sometimes. I've had plenty of patients that have been screened, everything looks okay in the screening, but I find things, or even vice versa, the screening, something is wrong with the screening, and then I find nothing. We check not just vision, if the patient can see or not, but we also check how the eyes work together.
Mm.
We also check things about focusing up close, which is also oftentimes missed. So when you get a screening done at your local pediatrician, what do you see? You see them, they look at the board, right? So fast forward now past 2020, what are our kids doing? Are they looking at boards a lot? No,
Mm.
they're looking at close objects. Who's checking their close vision? That's a whole different mechanism. And if we don't actually get examinations, which are proper binocularity checks, not only distance vision, close vision, and the health of the back of the eye, that child is not really being checked. We're just, we're just trying to find major issues through the school. And that's not to mention the increase of issues that we see with learning. I always tell parents, if your child has anything that's even borderline difficulty in school, why shouldn't we check the vision? That should be a very high on the list
Mm.
point, because when you're uncomfortable seeing, do you think you want to learn? No, it hurts, or you avoid it, or you try to find ways to compensate. So, with learning deficiencies, et cetera, I think eye examinations should just be an automatic referral, just to have that patient as comfortable as possible in order to get the other help that they might need, and it would optimize the other help if we knew that there was any visual issues.
That is so profound and surprising, to be honest, because when I think about kids having learning troubles in school, oh my goodness, we're going to the diagnosable letter diseases, right? The ADD, the ODD, all the letters. We're
Mhm.
looking at dyslexia, we're looking at behavior. Maybe if we're lucky, someone thinks about nutrition, but what you said makes perfect sense. Why not make sure at least that they can see perfectly well? And I also like the distinction you made between vision and eye health. So the
Mhm.
screenings mostly are looking at vision, right?
Mhm.
Can the child see well? But there's all sorts of eye health issues. Really curious, Dr. Joya, can you think of any kids or adults where you found an issue that didn't have to do with vision, but it ended up, the eye health impacted their life in some way and it turned out to be really, really good that you had discovered something?
Yeah, there's actually, not to get into like very advanced eye diseases, of course, who wants to discover that? But one type of eye health issue that is actually becoming more common in children, it may sound very frivolous, but it's dry eye.
Oh.
So, as much as you would think dry eye is for adults or people who have other issues, dry eye is becoming more of an issue in children too. And it can be connected as of now for a multitude of reasons. We have issues with inflammation, even younger, but also with screens. We tend to not blink enough. And we found that when you reduce blink rates, which is very well known that happens in certain types of attention needed, programs, et cetera, whether it's a video game or even test taking, on screens, especially children tend to, and adults, but they tend to reduce their blink rate, sometimes over 50%. So now, somebody's doing this for 5 minutes, okay, but now you're getting into 1 to 2 hours, and we're seeing these kids are getting dry eye. Also, the blinking mechanism can pump oil onto the eye, which is actually a natural lubricant. And we're getting, capped meibomian glands, et cetera, where the kids are actually getting dry eye syndrome. And that is actually reducing their vision or making them irritated, unbeknownst to the parent that that's connected. And that's avoidance of, trying to do other things, or they just don't feel good, or they're rubbing their eyes. So dry eye is, I wouldn't call it a massive eye disease, but it is something that I would say that is found more often now in kids that may reflect on their vision. And if the doctor is really astute in finding that younger, we could start mitigating that with, therapies like exercises.
Mm.
And we could start mitigating it with nutritional support, etc. The sooner the better, and create habits that will really help them as they get into like high school and whatnot.
Very interesting that you've mentioned. I mean, I've asked two questions so far, completely unrelated to technology, and already twice, you've talked about the increase in time kids spend on screens. You've talked about, an issue that arises from screens. I mean, it's a question that's got to be asked specifically when we think about the increase in technology, the increase in the time our kids' eyes are
Mhm.
on screens. Is dry eye the only thing that's increased? I'm a little nervous to hear your answer.
So, on a global scale, there has been a huge uptick of nearsightedness, myopia.
Really?
So it's a global problem. It's not a USA problem. Our genetics have not changed in the past 20 years, right? So the question is why? And it is not a proven connection, but I would say we're at the point that it's way too correlated that all of a sudden our lifestyles have changed and we have been putting a near point increase, stress on the eyes, and it's adapting to that. And when you're nearsighted, okay, maybe the argument is like, okay, you just wear glasses and contacts and you can see. The problem is that as patients are more and more nearsighted and at higher levels, that in and of itself is a precursor or a risk factor for ocular disease as they get older. So retinal dysfunction, like retinal tears, retinal holes, glaucoma, all of these other eye diseases can be linked to or risk factors with the myopia. So the problem is not, again, wearing glasses and contacts. That may seem to be the problem at first, but it's really, we're basically creating a pool of people that have higher eye disease risks as they age.
Wow.
And that's a problem. We used to spend a lot more time outdoors. Our ratio of indoors to outdoors was different. And we're seeing changes in how the eye is adapting to that.
Wow. Are we
So
seeing the nearsightedness also at younger ages? Or
absolutely.
okay,
Higher
so it's
numbers,
both.
younger ages. It's actually there's a whole subject and subspecialty in optometry and eye care called myopia management that was unheard of. When I graduated, we barely even talked about it. It was very small, and now it's becoming its own subspecialty, myopia management, nearsighted management. Why? Because we want to try to not allow nearsightedness to go up, because we
Wow.
know the issues as they get older that we are going to have more eye disease risk.
Well, and
So
I
that's
appreciate that you specified too, like our genetics can't change that fast. So it's something about our lifestyle,
correct.
which, from a functional perspective, of course, we got to ask the question, forget management. What's the prevention? How do we mitigate this?
So prevention is it's difficult because it's lifestyle, right? So prevention is I wish we all had a perfect pill and there's your prevention, right? So it's kind of stepping back. And I think we have to step back with all conditions. We have to actually look at it not in so much detail, but we have to look at our system as a whole. We don't appreciate home eating, right? We don't appreciate that dinner time. We don't cook as much. We're go, go, go. We're not outdoors as much. So our lifestyle has changed, it's creeping up. And now we're looking back and saying, oh, what happened? So we have to like pump the brakes. So the first thing is, I don't care if we're treating eye conditions or just health issues. The earlier you start teaching your children about nutritional valued foods, and nutritional density, the better it is. And for eyes in particular, the two biggest words are called lutein and zeaxanthin. They're very big words. A lot of kids and parents always say carrots, 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 right? We've always heard about carrots as the healthiest food for the eyes, and it's not. It's green leafy vegetables, which have lutein and zeaxanthin, which are the most robust carotenoids in the back of our eye. And they're basically the main two things that are found to mitigate as much eye conditions as we know. It's even in pregnancy. I mean, we have the reason why colostrum is tinted, it's got that color is from lutein,
Mm,
from breast milk. And there's a reason. There's a reason for all of this. Naturally, we want to have lutein and zeaxanthin at a young age. So green leafy vegetables early on, as early as you can get your kids to help put these things in their foods and you being the model for them.
mm,
You do it, it is a much easier sell to them than if you're not doing it and just enforcing it. Getting kids to talk about food and talk about nutrition with you when you're creating a dinner. What is the nutritional value of this ingredient? Makes them so engaged with that food that they are more willing to try it. And I think one of the biggest things for eyes, kids love eyes. I don't know why. They think it's cool. They love eye models. My daughter's school, I was at parent teacher last night and they were talking about eyes and not knowing that I'm an eye doctor or whatnot. And they get excited and talking about different organs too. Like this helps your eyes, this helps your heart. I think brings in value to get healthy food started at a younger age. We know that lutein and zeaxanthin, they neutralize blue light because blue light is a certain nanometer in the visible light spectrum and it neutralizes it. It is an antioxidant for blue light. So yes, we can talk about screens and everything all day long, but we also have to think about what are we ingesting? And unfortunately, it's both ends. We're adding our lifestyle problems and we're not eating foods to help mitigate those lifestyle problems. So, we're just doing everything kind of too quickly. We have to think about what we're introducing at a younger age.
I am so, so glad to hear you say everything you just said. As an eye doctor, do you have a thought for parents on screen use in those really early ages, those toddlers and preschoolers, particularly as you mentioned? It's one thing to watch a TV 10 feet away, another thing to have a phone 1 foot away.
Correct.
Yeah,
Yeah.
to give parents some rules here. Be
So
bold.
yeah, and the rules have changed. So there was the American Pediatric Association pre-COVID had some really strict rules about digital time, almost unusable, especially during the pandemic. And they loosened some of those metrics. I think under the age of 1, there's no value of electronics.
Yay! Me too.
It doesn't even, it's like, keep it away. There's no reason to have a phone in front of an infant. Think about it this way. Their eyes are so clear, which is a good thing, right? They're so fresh that a lot of that light gets through so well. And their pupils are big and everything's just getting in there and you're literally blasting a light into their face. It's not recommended at all. Now, once we get into that toddler phase, I think if you say no to everything, you're also asking for trouble. There has to be a little bit of a balance. But I tell my patients 20 minutes is where I cut the cord, 20 minutes and then breaks. So it's, I would say if anything as a parent, it's breaking it down and adding breaks into it versus having extended use.
Okay.
And the
And
breaks
that's different
allow
than the AAP, right? American Academy of Pediatrics sort of gives blanket like X number of hours per day
correct.
in
And
each age group.
but that's, if you think about it, again, that's the general, right? But if
Mhm.
you think about it, when even as an adult, if you're staring at a screen for 20, 30 minutes versus 2, 3 hours straight, do you feel a little different? Of course you do. So, I mean, it's the same thing, for kids. If you're staring at a screen for X amount of hours straight, you're going to induce more eye stress. Versus when you unlock, you're going to use your eye muscles a different way. You're going to start looking at your far vision. Maybe you'll blink a little bit more, because now you have that, you don't have that stimulus. So I would say adding more breaks into your computer digital use for kids is probably my best advice, on top of limiting the screen time as a whole. Yes, we know that has been talked about to craziness after COVID and all of that. But I think what is lost in value is that taking breaks is essential, and telling your kids to blink. We were on a plane recently and I was looking at my daughter. She was watching the screen behind the on the airplane, and I'm looking at her and she is not blinking. And I'm like, blink, please, just start blinking. So just giving little tips for the screen use is good. But yeah, breaks. And I've oftentimes written actual prescriptions. I've given to parents. I said, go outside.
Yeah. I love
Go
that.
outside. And that's the prescription. And of course, going back to the food is essential. And the earlier you start with green leafy vegetables, bell peppers, egg yolks,
Mm.
things that have that lutein value, the better their visual outcome can be, whether it's in a few years or as they get, into their elder years. Those things are foundational.
Wow. This is just so, I love that it's so practical and, just takes sort of some of the advice that we've heard from other medical professionals and says, you know what, just shift this a little bit for eye health. And super interesting that, we're seeing this increase in myopia and nearsightedness. And you're saying, we don't know yet. We don't have the research yet to prove it, but here are some lifestyle, modifications that have happened in our culture, right? We have more screens, we have less time outside, we're eating more processed foods and fewer, high nutrient value
Mhm.
vegetables.
Yes.
These are, why not start to sort of turn back the clock? I like how you say just slow it down, slow down our forward motion. We're moving a little faster than our evolutionary muscles can catch up. Really curious when we're talking about screens, we see the blue blocking glasses
Mhm.
everywhere. I know they make them for kids. I know I have some that I wear at night. What is your thought on those? Or even I know there's non-orange glasses that you can wear
Yes.
to reduce eye strain. Do those
Mhm.
work? Are they hooey? What's the deal?
So the deal is there's no regulation on those. So when we have eyewear, for example, the glasses I'm wearing has certain regulatory check marks that has to go through. Um, we don't have that for blue light. So the problem is that that's the first problem. So you actually have to know what you're purchasing. So you might actually be purchasing something that has nothing in it and it says blue light on it. The label is meaningless. So you have to find a reputable seller. So certain brands, certain types of lens coatings are officially blue light reducing. Blue light blocking, as you said, we are not actually blocking with those glasses. To block blue light, you have to be pretty orange. So, I don't see parents, I don't see many adults using those types of glasses, but for kids, there is no officialness. There is no recommendation for blue light glasses. No one's saying you have to do it. For my standards, it's about more of the melatonin question that goes into play. So if we reduce blue light exposure after a certain hour, especially about that 3-hour window prior to bedtime, so now you're either avoiding electronics or blocking some of that blue light off the electronics. You're only supporting your melatonin and your circadian rhythm, right? And tell me that's not important for kids, okay? The recent study that is very controversial that just came in out of one of the meetings in Italy is about talking about blue light and hormone changes in kids. So this is a huge, huge field that is only going to get bigger in terms of research because it's new. It's new.
Mm.
Is there a blue light? Is blue light really talking to your brain and hormones? And we think it is. So that's where it gets very exciting in the sense of where we're going to really get to a commonplace and understanding of this. But I would say, generically speaking, blue light glasses are technically meaningless until you know who you're getting it from. Make sure you're reducing blue light about 3 hours prior to bedtime so that we can get the proper triggers for melatonin production to the pineal gland. And if you were to invest in blue light glasses, the best time to use it is towards the end of the day in children and making sure it's a proper one.
Okay, gosh, that's interesting.
And
Part
it's
of
a
me when I
continued. It's to be continued. This conversation in 2 years, it's going to be a lot more sound in
okay,
terms
because
of
more research is being done, more products will come on the market from hopefully reputable companies who
so
are,
they're out
actually
there.
doing it.
It's going to take some time.
Yeah, yeah. Whenever I think of blue light blockers for kids, my gut just says they should go to bed.
Well,
Right? If
exactly.
the sun is down, they should just go to bed.
Yes, and that's the thing. And as parents, I mean, we're constantly guilted by not being good enough, right? Or not doing
Mhm.
things correct. And there's a lot on the list. There's a lot on the list. So you try your best, you do the things that you can do. And, there are blue light glasses that are good. And, if they have to do their homework late, maybe have them wear them a little bit. um, because sometimes it's just unavoidable. You can't do everything perfect every day. And I get that.
Yeah. Well, and there's children who have smaller faces and actually should have an 8 o'clock bedtime. And then
Right.
we still have to parent them when they're teenagers and full size and their circadian rhythm has shifted and they want to stay up until 10 and 11 and 12, and their lifestyle may demand it. I have a senior and a freshman in high school. So when I think of them,
Yeah.
if I said to my senior in high school, no screens after dark or no screens 3 hours before bedtime, he would not get his homework done. And he
Mhm.
actually works video editing for me. So if we make a mistake, he will edit it out after 9 o'clock p.m. for sure. That's when he works. So
Yeah.
it's a really interesting question of, how can we can't block it. Like you said, we
Mhm.
can't just turn that part of our modern lifestyle off realistically for most families, but how do we mitigate? You talked about greens, screens and greens. These are very tricky
Great
both
one.
for
Yeah. And
both
lutein
for
and
kids.
zeaxanthin, yeah.
Yeah, any kid-friendly ideas to get those greens in?
So I don't wanna say trickery, but greens, I think you should play with different greens because some kids may like the flavor of a spinach or another child might like actually kale. I mean, even though
Mhm.
kale is a little bit tougher, there's baby kale and there's dinosaur kale that you can kind of soak with a nice dressing, etc. It's really my goal, my trick for most greens is smoothies.
Mhm.
So, getting greens into smoothies is actually awesome. So you can make smoothies taste wonderful and it has greens in it. It's a great way to get a lot of vegetables into a nice dosage so you don't feel like you're chewing so much. And kids love smoothies because it's kind of like a little bit of a treat. So I'm a smoothie person. That's my biggest trick. And then obviously I creep in greens as much as I can. And I do a standard. I do a standard salad with every meal.
Mhm.
Whenever we have dinner, there is 1000% a salad on the side. It's just the way we eat. There's no questions asked. It's not a special evening. It's just always there. And we just have a few little leaves at the end of the night or, in the beginning, wherever they want to eat that small amount of salad. So if you don't make it so um special too, that it's just this is how it is. Sometimes that works too. And supplementing with kids too is something that oftentimes is done, especially once they hit that those teenage years. So there are some really awesome lutein and zeaxanthin supplements because again, we're trying to mitigate from in out that blue light or all the oxidation that we get on our general days. And I think that's an also a good way to get in some of that green percentage by just supplementing too.
Oh, that's great. And I would throw out greens powder too. We dehydrate our own greens powder
Great.
regularly. And I mean, just bags and bags of greens fits in one little jar. So you don't have to add very much. I've got a super taster in our family. So whenever I add greens powder to like scrambled eggs, I
They
have to
know.
be very careful because if I hit a pretty small threshold, they go, Mom, we can taste it. Stop
Yes.
it.
Yes.
But casseroles and like rice dishes hides
Mhm.
the greens powder much better from one, one mom to all the rest. Well, Dr. Joya, this has been just a really fascinating and may I say eye-opening interview already. And I just always like to end giving our parents a very practical step. Sometimes we can listen to so much information. And like you said, it's easy to go down the guilt route. Oh, I'm not doing enough. Forget that. No guilt, no shame, parents. We're just going to try to do one new thing. If parents walk away from this interview and do one action step, what would you have that be?
Get your children's eyes checked.
By an optometrist, not a pediatrician, correct?
A full eye exam. That is the first thing. I think that's really, really underutilized, and I think we would have kids in a much better state if we actually check them properly. To start fixing things early and
Mhm.
recommending things early that might help them for learning later. The earlier you find problems, the better their chances are.
It's easy. It's one thing per kid. It's not a new habit, that you have to implement, parents. But I also really appreciate too, Dr. Joya, that you've helped change our mindset a little bit when we can look at a learning behavior or learning trouble in a child and think, oh, what about the eyes?
Mhm.
And we can look at screens and say, oh, instead of decreasing my kid's screen time, what if we can just help break it up into chunks? Like this is just so simple, so practical, and so purposeful. So I really appreciate you being here. Thank you so much.
Thank you, Katie, for having me. I hope your audience gets some valuable information and starts tomorrow.
Most definitely. Healthy Parenting Connector listeners, once again, I'm Katie Kimball for Kids Cook Real Food, and I will see you back next time with yet another expert to help you be an intentional parent raising healthy, independent kids.